Thank you. Well, good morning. Welcome to our MOTS monthly checkpoint, is what we call it these days. A Rhodes monthly check. MOTS is still in my head, and it'll be for a few years. Been with the MOTS team since 2012, I think, when we started building and creating and working on that. But it's Rhodes now, and it'll come. Don't worry. I'd like to welcome everyone. Thank you for joining us for our monthly webinar. And the focus today will be on portal users, and the majority of you will be. And we know that sometimes EDI users also like to join just in case we have any updates and any news that they didn't pick up last time. So why don't we start with looking at a very full agenda. I have a lot of issues there, so let's get going right away and meet the team. For those of you who do not know us, we have Kayla, that's Rhodes System Admin, and she's running the presentation today. I'm the MC, Piet Vermeer, Senior Systems Analyst, and Mary, the Support Specialist. You probably worked with her, talked to her, sorting things out, making small corrections. Or she's with Cecilia the first line of defense for any issues that you might have. Also, we have Justin, our report specialist and research analyst, Jody Kramer, our EDI technical expert, Lisa, junior system admin, and I like the junior thing. That's always a good thing. And Amelcha, report specialist, similar as Justin, but a little different systems because as a team, we have different areas that we represent. And Kelly, of course, who could not make it today. She had other things going on, but she is our main communications person of the team. And she was the one who created all these slides and put the whole thing together. So we are just using this and hey, that's the team. Thank you. And we're having this nice little slide these days that we put in there, and it's kind of like on the dog scale. How do you feel today? Just put up some numbers, then I can see, are you a 1, like nice and cozy, or are you a 3 and it's definitely needs a lot more caffeine, or do you just a 4 and comfy and cozy, whatever, or 5, like, I like these little hats. Huge grin on number 6, and 9. Number 8 is kind of very sad dog at the moment. And number 7 has the iPads in, so. Cool. Yep, I see a lot of 5s. That is kind of, yeah, it's 9 o'clock. It's still early, middle of the week. I see that. Can it be a 5? Yeah, definitely. And some 7s. Just ignore everybody. I like that. Cool. Thank you, guys. Just a little thing. Okay. The monthly webinar series. And there we go. Welcome to our series, and I kind of did the bit of the presentation. It is something we do every first Wednesday of the month at 9 a.m. and we've been doing it ever since for the last 10 years or so. It is always recorded, so just in case something happens and you get called, and if there's a fire to put out, then you can't finish the whole thing and you think it's pretty interesting and you really want to come back, then you can always find it on our website because we posted by the end of today. It's probably there already because that goes pretty quick. Might not be today because Kelly, our communications expert, is not in today, so it might be tomorrow. But what we do is we like to communicate with you guys. We have any kinds of updates, anything that's changing, any improvements, any best practices. We talk about data. We like all the opportunities that you might have, and it's one of the things that we like to do, and we kept it ever since we started it, and it was a really good way, and we got really great response from the field, from all the treatment providers. And the nice thing with the current more modern technology and Teams is that it's a lot more interactive. I remember the olden days when it wasn't presentation and that's all we can do. And then sometimes we kind of could sort out the communications and some questions in here and there. But now the nice thing about it is that if you have a question, just pop it in the chat. And if you really want to discuss something, we can always open up the mic and discuss these things. So, okay, that's what we do. And then the next is Jody. She's going to talk about big news, breaking news, extra. Go ahead, Jody.
Yeah, definitely. This is definitely a latest roads news and alert deal. You'll probably be getting this to an inbox near you soon. We did a rollout about 2 weeks ago to our roads production environment, and we realized that we have some case sensitivity errors. So some of you may or may not be noticing this in the portal or getting a error on it, but our folks that are submitting through EDI for sure let us know that things were happening. So we're aware that our system recent change created some issues around case sensitivity. We really appreciate everybody who's like, let us know there's an issue, and of course, your patience. We do have a fix that's in progress, and it will be going in this evening, is our planned course of action. And then by Thursday, tomorrow, it should be done. And anybody who is submitting files, the case will not matter whether it's all uppercase, all lowercase, uh, if you're doing proper upper and lower. Basically, we have asked the system to um, change it for us to proper case. So basically, whatever you put in, it will convert it over to the upper lower. So again, this will be done tonight. The portal will be unavailable due to this, starting at 5 p.m. this evening to we approximate 9 p.m. Oftentimes we're done sooner, but that is the time scheduled for this fix. We want to get it in and get it done as soon as possible. So if you are like after 5 working and you try to get into the portal and it's like, hey, I'm shut down for maintenance, that is why. But it will be back up and available for you on Thursday. That's it, Pete.
Pete, you might still be on mute if you're.
I just got the message. I started talking and then the thing popped up. So, okay, what is a non-Medicaid service? That's an excellent question, and we've been getting that question for many, many years. And here is a lovely definition that says a non-Medicaid service is any service, and we talk any service, provided to individuals not covered by Medicaid or OHP. And these services have to be entered into the roads after they've been delivered. Unlike Medicaid services, which are captured automatically through MMIS claims, non-Medicaid services are submitted separately by the provider, and you can kind of enter them in. Do not submit non-Medicaid services for crisis or involuntary events. That's a different story. It's the non-Medicaid services only go in if you have a episode of care for mental health or substance use disorder. That's when we enter those services. We used to have a very nice reporting diagram that for me that was always very comfortable because it had a diamond that had the question, and then it says, okay, this procedure, is it funded by Medicaid or OHP? And if the answer is yes, then don't worry about it. And then you're done with the diagram. But if the answer was no, then you go into the next question diamond and it shows, is it DOII or methadone? And if the answer is yes, if the service is related to that, then yes, submit the AMH non-Medicaid service reporting. So that was another question. If the answer was no, was not DOII or methadone, then the question is this service, this service that you're providing to this individual, funded by private insurance or 100% private or 100% private pay? Then, and if the answer is yes, then you're also out of the loop and do not report them. And if the answer is still no to the last question about funded private insurance or 100% private pay, then you go down and then it comes to yes, you have to submit the service. So that diagram is available, and I'm not sure if we kept it in our documentation, but if
I just put it in the chat, Pete.
you just put, oh, dang, she's so fast, isn't she? I'm always very nicely surprised by how quick Kayla is responding to these things. So yeah, that diagram has always been very helpful to me. And if you always have any questions, then you can check that out. Sometimes I refer to the billing people within the organizations because they usually know what they send as claims to Medicaid and what they're not really sure of, and then you can kind of sort it out with them. So that's roughly the non-Medicaid service question. Cool. The next item on the agenda is MFA, multi-factor authentication. Lisa, go ahead.
Thanks, Pete. Okay, so don't boo and hiss at me for any of you that have had any issues with MFA. Yeah, I know. I can feel it. I can feel it. I can feel the stares. Yes, MFA, multi-factor authentication. If you haven't done it yet, we would suggest getting that done before you need to report anything into the Rhodes portal. I am usually your first line of support. If you send something to our inbox, I can put that in the chat as well here in just a moment. Anytime that you have any issues or have any error messages when you try to log in and you are not able to get through, please send us an email. I'm happy to help walk through the steps. The service desk has incredibly knowledgeable techs there. So if you call 503-945-5623, option number 3, you will speak to somebody that will know about Rhodes and MFA. My biggest tip of the day is to make sure that when you're having this conversation with any of our capable techs, that when you finalize the configuration, be sure to make sure that you test your authenticator while they're on the phone. We have found some recent issues with that process not happening and people are being denied access. So that's my fun fact for the day. And again, if you should ever have any questions, we're here to support, so feel free to reach out to us. It's been a learning curve for us, and we know it has been for you. So we appreciate your patience and grace with all of this.
Excellent. Thank you, Lisa.
Happy to help.
Okay. Guess who? Things to note. Lisa, you're still up?
Surprise. So if you have any correction requests, like client ID, admission date, last name at birth, that should still be sent to us, to the inbox for processing. We have a team of people. You saw Mary at the beginning of the slide. She's probably one of the first people you've reached out to. Or if you notice something unusual, we encourage you to let us know. We're still refining parts of the system. So if you encounter something that's weird or seems atypical from any previous experiences, send us a detailed message. If you could include a screenshot, that is also helpful. That way there we can dive right in and start investigating any of the issues that you may be having. And I see that Kayla might be typing something in the chat, so I'm going to pause for just a second to allow the space to answer or provide more resources. And also she said, apologies for Mott's in there, it should be Rhodes. So it should be Rhodes client ID. We are also having a tough time transitioning and getting that muscle memory around using Rhodes instead of Mott's. So thank you. And I'll let you take it away, Pete.
Thanks, Lisa. Technically, some of the Rhodes IDs could be former Mott's ID, so technically it might not be wrong, although we should call it Rhodes ID. So, okay, we're giving the microphone back to Jody on how often to submit data. She knows everything about that. Go ahead, Jody.
That's right, the knower of all submissions.
Yep.
So yeah, we kind of wanted to talk about this as a reminder for folks that regardless if you're using the portal like you are here for you folks on this checkpoint, or if you're submitting through EDI, there are some submission things that we expect. So new clients within 7 days, crisis events within 7 days, and those are calendar days, by the way. not business. Involuntary service events within 7 non-Medicaid services. That's basically that we expect that, like, for example, the non-Medicaid services for July would all be entered by the 15th of August, right? Which is coming up here in another week or so. Once you've told us you have a new client, we expect a status update every 90 days at a minimum. You definitely can tell us more often if things are changing with them. Sometimes with EDI, folks are sending stuff weekly, which is great. At the end of treatment, we expect that reporting within 30 days. So we want to know that they're no longer in treatment. Stabilization services, which is new with the Rhodes solution. Those are reported to us within 14 days for admission and discharge. So a lot of things on how often to submit. Another thing that's important to note is that when you are reporting into Rhodes, or let's say you're new and you get access to Rhodes and you get your user set up and you're all ready to go, but then you're like, oh, I don't know, like we might need somebody else to do this data entry and we need to get them set up as users. And like maybe, 3 to 6 months lapses by before we know it, and you haven't put any data in, right? Well, what the process is, you're expected to put your active clients that you have at the time you get access to the system. So if you wait 6 months, the expectation is you would need to go to the point when you had access and put those clients in moving forward. So you would need to report the ones during that period of time where you were trying to kind of get things straightened out, or maybe you have a change in staff. We definitely want to make sure that you are able to put your clients in as soon as you can and that you keep doing so. If you're a submitter and you have not submitted you've got a gap in submitting for some reason, maybe it's 6 months, but who knows, right? If you're already an existing submitter and you have a gap in reporting and you need to know how far to go back or what you need to do, send an email to the Rhodes, our support team, and somebody on our team will align with you, and we will try to get the right folks on board to help us determine how far you need to go back, because we do know things happen, right? And we want to work with you, but we also want to make sure that we're getting the data in that is, very critical. So with that, hopefully that made sense, and I will kick it back to Pete.
Excellent. Thank you, Jody. Yeah. And Apollo, can you come back a little bit? Sorry, Kayla.
Yes.
We say reporting cadence, but this definitely is submitting cadence. When do you submit? And it's terminology that I apologize to Justin. We were talking about changing this because a lot of times we talk about us reporting to the treatment providers, to you guys, and you submit the data, because otherwise reports get easily confused. So I just wanted to bring that out. And a very good tip from Justin, because the status update has to happen every 90 days. Sometimes especially in a lot of mental health treatment, outpatient treatment, stuff like that, nothing really changes, but you just going through the data, make sure nothing changed, and then kind of hit a submit. That counts as an update, because then the system will say, okay, this is the latest submission that we received. So we get that question once in a while. So thought I'd bring that up here. That's all. Thank you. Okay, recent updates. Kayla.
Thanks, Pete. Hi, everybody. My name is Kayla Camelli. I am here to give you our recent updates. We recently pushed some updates to our production environment. There were a number of folks who reached out that were trying to use diagnosis codes that we did not have in the system, so we've added those. Those are listed here. We also were notified that diagnoses with apostrophes were not being tolerated in the system, so we fixed that too. So now, if the diagnosis you're trying to use has an apostrophe, it will be accepted. Additionally, the system will automatically prioritize substance sequences in the portal if one of them is deleted. And I just experienced this yesterday, and in another environment, and I was like, wow, I really wish this was different. And now it is different, which is great. This is just a snippet of the updates that happened in the road system recently. I will put the link in the chat. We are now posting all of our system updates on our website under, I think there's a specific table for website development updates that will list out all of the changes that have happened in the system. We do have a new process where we are essentially mapping folks that reach out about a problem that we are able to fix. So we should be able to wrap back around to you if you reached out and said, hey, this diagnosis code isn't in the system, I need it to be there. We will mark it, keep it in a place, and then once that diagnosis code gets added, we should be able to reach back around to you and let you know. But if you want to be on top of it and proactive, we are posting a summary of all of the updates that our system has received anytime there is a hot fix or a minor or major release. And that is on our website under our resources and FAQs page. And back to you, Pete.
Excellent. Thanks, Kayla. What is next on the agenda? Training opportunities. Lisa, mic is yours again.
Thanks, Pete. All right, I get to talk about something a little more user-friendly than perhaps MFA. So are your training opportunities? There are a few different options for you. If you would like to obviously see the introduction to roads, which is mostly just a lecture. It's our webinar, obviously, for a high-level overview of the road system. And it's perfect for any of your new team members or anyone needing a refresher. We also offer the roads portal training. You will see most of the same group that you see in here doing all of these sessions. You get to attend a live session focused on navigating through the roads portal. We'll cover some key functions, best practices, and frequently asked questions, and help make sure that you have a smooth user experience when you are in the portal. However, I will add this, not to bring MFA back up, but if you do want to join us for the roads portal training lab, you will need to have a P number and a UPN, which is essentially your username when logging into Roads, and have MFA configured in order to partake in the training environment and work through some of the demos. We give you lab time to practice in the train environment, but you will have to have both of those things and MFA configured in order to dive into the training portal. That doesn't mean that you cannot. If you don't have those things, you can obviously observe and learn. But if you're more of a hands-on learner, that's a great opportunity for you. And then momentarily, I will get our user request form into the chat if you would like, if you still need a P number or a UPN. We also have a variety of self-paced resources that are available on our OHA page. There's training videos, there's user guides, and step-by-step tutorials to support, your process and learning. And then we also will have EDI-specific training that is currently in development and will be scheduled soon. If you're an EDI provider, watch for some upcoming communications. We have our Roads newsletter. It's called The Navigator. If you haven't signed up for that, let us know. I can also provide a link for that as well in the chat. And join us next month on our next monthly checkpoint, and that will be focusing on EDI. And I will pass it back over to Pete so I can get those links for y'all.
Wonderful. Thank you, Lisa. Okay, where do we go now? Their usual spiel from Jody, switching from portal entry to EDI. Go ahead, Jody.
A spiel. What an intro.
Spiel.
Yes, actually, absolutely. So if you're, like, hey, we're kind of tired of submitting manually, we're looking at a new EHR, and you're thinking of changing from your portal entry to EDI, there's a few things that you need to let us know about. And the first one is the notification of change, hence it being in blue, unlike the rest of it. Because even if it's, 6 months or a year out, or maybe you're considering looking at different health, systems, like you were looking for a new one, let us know that we can kind of keep you on the radar, make sure that we've got you on our roadmap, pun. Anyways, so that we can make sure now somebody available to assist you along this path. Now, when you're going, or if you're looking at, right, electronic health records, it's really important to ask them, what is the roads functionality? Like, what does it take if you were to get system ABC 123? What does the actual process look like for this functionality? How does it work from the time your client comes in the door to your submission actually coming to Roads electronically? How much staff time will be required, and who's going to do which steps? Because there's often this myth that if you go to EDI, you have to do like nothing. And there's a few out there that are close to that, but sometimes there's always some staff intervention that needs to happen to get things in the right spots, to get information back to staff. So it's nice when you're looking at these systems to know that functionality, so you can determine, like, okay, what will the staff time be versus maybe doing it manually? There is absolutely no one way that is better than another. There are just differences in workflows with all these different systems. We do have an alphabetical list of the EHRs that are currently submitting to the system electronically. If anybody needs that, you can reach out to the road support or myself, and we can get that for you. So of course, the next things on this list, the project timing is super important, because we want to make sure that myself or Pete or somebody is riding alongside of your project, making sure that everything is happening when it should. We want to get your process for switching the submission, because there'll be a time period where we lock you out of the portal while we bring up your EDI. And when I say lock you out of the portal, you're not really out of the portal. You're just like, you can't manually enter stuff anymore. We set up a location on our servers called a file transfer protocol setup. It's basically a mailbox where you or your system will drop your electronic files off and pick up your results the next day. There's some client ID considerations, as we were talking about before, Mott's client ID, now Roads client IDs. When you go to a new system, oftentimes those will change based on maybe your system's automatic way of assigning client IDs. So we want to talk about that, make sure we have you covered. This is kind of your thing, but defining your business processes ahead of time, or as you're coming up with your implementation and go live, is super helpful. So each person knows what part they'll be doing at your organization. And then of course, how to get a hold of us and for support. Testing the files through EDI. So even if you go with a system that already has, say, 1 to 10 or 20 providers using their system, we're going to test your files individually, because with all the customization, and that might be why you're looking at a different system, you want different features and things available. We want to make sure that all of that setup is working properly and aligns with the road system. So it's easy. We go through it. We go live, which is exciting. You're actually sending your data. And then we offer some follow-up after you go live, because, we do all this prep work and you go live, and then you're kind of like, oh, wow, now I got the real information coming back. What do I do with it? So we can do weekly follow-up, bi-weekly, monthly. We can do a graduated time to connect, but we definitely want to make sure that we're available for you after the fact, so that you're confident in what's happening and that things are moving along smoothly. So we've been doing this switching from portal to EDI, or vice versa sometimes. So we've got it all figured out. So as soon as you let us know that you're thinking of this, or maybe you're fast tracking one, we'll spool up the resources and connect with you and make sure we're partnering along the way. So I don't see any hands up, so I think I'm good.
Excellent, Jody. Thank you. Okay, then we're going to talk a little bit about the active episode of Care Reports. Justin, mic is yours.
Thank you. Yeah, we used to call these the active client monitoring reports. We've switched them up a little bit just because of some data structure differences. Now, active episode of care that is still scheduled to be delivered on the first day of each month to the facility primary contact and anybody with a facility role who is listed as report recipient equals yes. So if you're not receiving these reports and you think you should, let us know. We'll take a look at your contact roles and make some adjustments if we need to. There is a bit of a problem with the server that is causing some delays in getting these out as quickly as they used to for MOTS. So about 10% of you will not receive them on the first of the month. They get caught in an error loop and I have to go manually release them, which takes quite a while. So give us 2 to 3 business days after the first of the month and then you should receive these reports. Also, please keep an eye on them if there's anything that looks off, if there's a record that you think should be closed and isn't, or someone that should be open and they're not listed there. Take a look, let us know. We're trying to track down a problem that is somewhere between the data entry and the reporting. Not sure where it is just yet. We got a few leads and some developers working on it, but we do have some clients who are showing up as active when they should not be. And any help that you can provide in figuring out which those are would be appreciated.
Excellent. Thank you, Justin. Yes, the more help, the more examples, the closer the clue might be. So, okay, portal check-in. Kayla.
Thanks, Pete, and thanks, Justin. Before I get into our portal check-in, I wanted to add one more thing that I probably should have made a slide about, but I forgot. Pete mentioned it's like a clue. So when something is going wrong in the road system, it's not acting right. It's really helpful if you're going to reach out to us. If you take a screenshot of what you're looking at so that we know where it is. Sometimes finding these issues in the system, we have to become detectives. And the more evidence that we have, the faster we can find the problem. So if you don't send a screenshot or explain in detail where you are in the system, we will probably respond and ask for more information. And this just lets us communicate to our development team where the problem is so they know where to look. So I just wanted to mention that. If you do come across something in the system that's working, not as you expect it to work or you would expect it to work, let us know, but try to include as much detail as possible. If you're able to take a screenshot, add that to your email, and that would really help us resolve that issue as fast as possible. All right, the portal check-in. This is just a quick check-in with you all who are portal users. And I just want to know if you have logged into the portal yet. If you have logged into the portal yet, can you use our little thumbs up react button? Oh, I see a thumbs up. That's great. I'm looking at all the other folks in here. Okay, I'm starting to see thumbs up. Awesome. If there is anything that we can help you with or anything that you expected to be in this presentation but was not, please let us know. You can let us know in the chat. You can send us an email. We want to make this webinar series as helpful as possible to folks. So if there is specific information that you would like on a recurring basis, let us know and we're happy to add that in. Otherwise, I hope the portal experience has been good so far. There will always be things that we're fixing and also things that we're adding. So we're in the process of adding some additional views in the portal, which will help folks be able to identify clients that need to be updated quickly, because we know that is an area of interest for folks. You want to know which clients are close to that 90-day mark and which ones are not. And there's also going to be more training upcoming regarding our dashboard part of the portal, where you can see information and see data on like a higher level. We're going to be doing that training and involving that in our webinars here in the future. But we also have videos online about how to maneuver the dashboard section if you're curious. Lisa added the link to our roads homepage in the chat here, and all of those videos are listed on our website. So I will send it back over to Pete for our closeout and question slide.
Excellent. Thank you, Kayla. Yes, if you have any questions, issues, and not only if you are in the system and things aren't working as expected or feel a little clunky or something, or if there's something like, oh, if I'm on this page and I go do a lot from this to that and that and in a certain order, and if it's kind of become cumbersome, that you think, well, if you guys could do this or that, then would make my life so much easier. Don't worry about try to dream big and then just put it on a list, and hopefully we can, if we hear enough people asking for it, we can take it to our contractor and we say, hey, we have a lot of people, this screen and that screen, if they were kind of somehow merged or a couple of fields here would be there, then that would save them so much work, blah, 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 things like that. So there's so many things that we have and we haven't developed yet. And I'm in there off and on, and I look at certain things and I'm researching and investigating and trying to figure out things. So I'm not really into the day-to-day routine going from page 1 to page 2 to page 3 and put all the stuff in there. So, but maybe there's something like, hey, if you can kind of put this a little different, set it up a little more convenient in another way, please let us know. That we really appreciate that. And there's no guarantee it's going to happen soon. It could be next year, but if enough people ask for certain things, we have leverage to kind of like nudge management, say, hey, we want that kind of to move that in there and put that, at least put it in the conversation, that if somebody has a little time, then hopefully they can pick up those things. So that's one thing I wanted to bring up. So okay, if you have any questions, then you know where to find us, because we have the email box, roads@odhsoha.oregon.gov. And there's always somebody monitoring it, always somebody watching it. If something comes in, we'll get back in touch with you and confirm that we got the information, working on it, see if we can do something. So anything you might have, let us know and put it in that information. So. And then I think, was there one more slide, or was this the final slide? I think there's one more.
I think that's it.
That's it? Okay. Well, are there any questions? Is there anything I missed? I see all kinds of nice handy notes and kind of forms and links that everybody has set up. So thank you all for helping me out organizing that. And if I don't have anything anymore, thank you all for joining today, and I'll give you some time back that you can spend wisely, I hope, and have a wonderful rest of your day, and hopefully talk to you next month.
Bye, everybody. Thanks.